We are scheduled to enter step 3 on Friday, this coming Friday, July 16th. And we are continuing on the road of recovery. So I've always believed and known that Hamiltonians are resilient. And while it's not been a straightforward path going forward, Hamiltonians have worked together and stayed the course. And we're all grateful for that. Getting the vaccine and completing the vaccine series will stop the spread of the virus. This will protect yourself, your family, your friends, and the community. Thank you, everyone that has received your first dose or has completed their vaccine series. Well done, and we encourage others to do the same. Hamilton's vaccination effort, however, continues forward at a significant pace. Some 639,000 folks have been administered a dose of vaccine. 75% of residents of age 18 and plus have received their first dose, and from that group, 52% have completed the vaccine series, so 2 doses. And an estimated 63% of our Hamilton youth ages 12 to 17 have received their first dose, with about 20% of youth completing the vaccines series as well. So we're moving along quite nicely, and getting your vaccine is still the best tool we have that will lead us to return to the things we all enjoy doing. And for more information around that, please visit hamilton.ca/vaccine booking to book your vaccine appointment. Yes, and do want to express my gratitude to the entire public health team that has been working so hard to bring the vaccines to you, set up the vaccine locations, work through all the issues in terms of where vaccine uptake is going well and where it's not. All the administrators that have helped us work through that, we owe them all a great debt of gratitude for the enormously terrific job they've done doing that. And everyone on the front lines in the vaccine clinics continue to do a fantastic job of making people feel comfortable and administering this vaccine in a quick and efficient way. So I encourage you all to continue. If you haven't yet received your vaccine, all the walk-in centers are open at our major vaccine locations. So I encourage you all, get the vaccine. The more of you that get vaccinated, the sooner we can get back to a better sense of normalcy. So speaking of normalcy, things have opened up some, and I'm going to turn it over to our Emergency Operations Director, Paul Johnson, to kind of outline where we're at now and where we're going on Friday. Paul?
Thanks very much, Mr. Mayor. And very clearly, when Friday hits at 12:01 on Friday, more things are open, including many more indoor activities, and there will be greater number of people that are allowed to enjoy those activities, be they indoor or outdoor. And that is good news, but as the mayor says, it's an important reminder that we are still in the midst of this pandemic. We have not reached levels that anyone is satisfied with in terms of our overall vaccine program. But the fact of the matter is we are far enough along that the ability to enjoy more programs and services in our community and more activities is there. And it's now up to each and every one of us to both take that step and get vaccinated, first and foremost, best protection we can have, and then continue to follow public health guidelines where they're outlined, and also to take our own risk analysis of the things that we're doing. Generally speaking, there are a whole bunch of things that change on Friday morning, but some of the big ones, of course, are most of the indoor activities that people have wanted to enjoy for some time are allowed to reopen. This includes everything from theaters and cinemas through to indoor dining, gymnasiums, and indoor sporting activities. And so just important that people check out what the restrictions are. In some cases, it's just a matter of people having restrictions in terms of capacities. It may be 50%, it may be something else, depending on what the activity is. And then there will likely be some other additional precautions, particularly on the indoor activities, while we enter into step 3. But in terms of our own social gatherings, up to 100 people outside and 25 people indoors. And so that allows for much larger gatherings of our social networks, both from an indoor and outdoor perspective. And again, this is great news. This allows us to take advantage of seeing each other and connecting, but again, do that safely. And each group is going to have to look at the risks associated with who you're getting together with and make sure that you take precautions accordingly. From a recreation and sport capacity, as I mentioned, gyms are able to be open, as well as indoor recreation facilities. Most will have a maximum capacity of that 50%. The outdoor is increased to about 75%. And in the case of some large outdoor venues, can be up to 15,000 people that are involved from a spectator perspective. And spectators are allowed indoors and outdoors. It is a capacity number now, and people will be asked to hold to that capacity. But again, a chance to go and see people involved in those sporting activities and participate them as well. So we expect that lots of leagues and lots of organizations and lots of businesses that provide recreational and sport opportunity will be getting geared up this week and opening as soon as Friday just after midnight. In terms of some other activities in the community, things like museums, things like concert venues, and as I mentioned, cinemas and theaters are also all able to either open for the first time or open with more capacity. And again, this is good news as we work our way through the summer and into the fall. Some of the activities that we associate with the summer and early fall may be back to some level of normality because the numbers of people, again, particularly in the outdoor situations, are very large. And that allows us to see some of these events go forward, which last summer just weren't very viable. A few additional things to note: face coverings in indoor public settings and physical distancing requirements remain in place throughout step 3. And I know as people receive their news from various parts of the world, it's important to recognize what's happening in our jurisdiction, both our country and our province. And at this stage, those face coverings in indoor public settings and the physical distancing pieces remain. Face coverings will be continued in certain outdoor public settings. That's why it's important to follow all the good signage and maybe call ahead or look online before you go and do some of those activities. And businesses will need to check and make sure that they're clear on what their requirements are in step 3. As for all of the reopening that's happened to date, it does matter what you're doing in terms of what the reactions are and what the responsibilities are. And, you know, we only need to look down the road just a little bit to Waterloo Region and the Kitchener-Waterloo and Cambridge area, who only today are moving into step 2. And that's the result of the fact that they had some large outbreaks and large case counts related to the Delta variant. And I say that as a reminder of the need for us to be vigilant in terms of stopping the spread of this disease and recognize that still a healthy portion of our population is both partially vaccinated or unvaccinated. So it's important for us to be aware that the virus remains with us. It has not disappeared. It is not over, but it is important to note that the work we've done to get vaccinated as a community is setting ourselves up for success. In terms of the municipal side of things, we are taking on, of course, many more applications now through our special event advisory team process. So people who need to submit those applications for events because they're involving city services or on city property, do that. We will try and turn around the small events as fast as we can, and the larger events we'll put our mind to as well. We will be looking at opening up our recreation facilities. They will not be open for Friday at 12:01. We're really targeting for most of our indoor activities. These would be recreation centers, senior centers, and our indoor pools to be open for July the 26th. That gives us the time to do all the necessary inspections on the building, and it also allows us to make sure that our staff are brought back and fully trained. There's a lot of training that goes on, and with a number of facilities, we'd rather do that all at once than open all the facilities at the same time, rather than bleeding it out over a number of weeks. So really circle July the 26th on the calendar, lots more indoor activities at local recreation centers, and beginning this week, later this week and into next week, we'll be making those plans more readily available for folks if you want to book some things in. And this is going to be everything from some of our indoor recreation activities and services to looking forward to having swim lessons again in August start up, many more opportunities for lane swim, those types of programs that people have been waiting for a while for us to get back to some level of normal. We do have some restrictions on the number of people, so we'll have to manage that a little bit. But again, in a couple weeks' time, we'll be back in business from an indoor recreation perspective at the City of Hamilton, and that's very exciting. We'll also be expanding the ability for people to come and do business at municipal service centers and at City Hall without an appointment, and opening that up to just general walk-in business. And we'll, as the week goes on, provide some of that information to the community so we can shift again to some of that more normal course of business. But with all these things at the city, we've redeployed a lot of people to support the vaccine program. We need to make sure that if those folks are coming back to do other jobs, that doesn't negatively impact our vaccine program. And then the second piece is we just have an awful lot of facilities that need to be inspected. We need to obviously run the HVAC systems fully for a little bit of time and get them all functioning effectively so that everybody can be safe when they enter our facilities. So another couple of weeks of work and we'll be back in good shape as well. And with that, I'll turn things over to Michelle.
Thanks, Paul. So continuing on with the good news, overall COVID-19 case activity is maintaining at current low levels in the city, which is great news for all of us. As of today, there are 21,397 cases in Hamilton, which is a net change of 6 cases from yesterday. Local activity levels continue to mirror those that we saw earlier in October 2020, and those activity levels continue to be low among all of our age groups, which is positive news. The average number of new hospitalizations and the average number of deaths occurring per day are both steady and both low. Hamilton's 7-day moving average number of cases reported per day is 12, and our weekly incidence per 100,000 population is 14, with our weekly reproductive number at 1.05. Currently, we have 3 active outbreaks with no new outbreaks being reported today. Our percent positivity continues to trend downwards as well. It's currently sitting at 1.9%. So Hamilton now ranks 4th among public health units in Ontario, according to the ICES data. On the vaccine side of things, as mentioned by the mayor, we have administered 639,574 vaccines locally in total. And so we've passed some very encouraging milestones in our vaccine program, with an estimated 75.1% of Hamiltonians 18 and over, and 61.3% of youth 12 to 17 years of age receiving a vaccine to date. In addition, nearly 53% of adults and nearly 20% of youth have received their second dose to date. Case data from Public Health Ontario continues to show the effectiveness of COVID-19 vaccines. Of our nearly 17,000 cases reported in Hamilton since December 2020, only 0.3% of those were in fully vaccinated individuals, and 4.1% were in partially vaccinated individuals. That means over 95% of our COVID-19 cases since December occurred in community members who were unvaccinated. I know Mr. Mayor and Paul mentioned entering step 3 later this week, and I do want to emphasize that we are really at a pivotal moment in our community's vaccine program and our collective fight with respect to COVID-19. The Delta variant continues to be a dark cloud on our horizon, and communities in Ontario are experiencing severe impacts as a result of this more contagious variant. Waterloo Region, as mentioned, had an increased number of cases and outbreaks, and led their community really to being held back into entering stage 2 until today. And that's really a lesson to all of us that we do need to continue to be vigilant. The best way for Hamiltonians to protect themselves and their loved ones from the Delta variant and to help us to stay on course to enter step 4 of the reopening is for those of us who have yet to receive a vaccine to receive a vaccine as soon as possible. And for those of us who have not booked their accelerated second dose yet, should immediately move your appointment forward. At this point in time, everyone is eligible to receive that second dose of mRNA vaccine at 28-day interval after your first dose. And so if your appointment is later on in the summer or into the fall, we would recommend that you rebook that vaccine appointment and get your second dose sooner. The province has made it clear that Ontario will remain in step 3 of the roadmap for at least 21 days and until 80% of the eligible population aged 12 and over has received a dose of COVID-19 vaccine. And 75% must have received their second shot, with no public health unit having less than 70% of their population fully vaccinated. So by continuing to follow public health measures and community members completing their vaccine series, we can do this as a community, and we can all get back to those we love doing the things we love doing. Access to COVID-19 vaccines is getting more convenient as well. Last week, we, along with our healthcare partners in Hamilton, were pleased to begin offering walk-ins for those 12 years of age and older looking for a first dose vaccine. So at this point, walk-ins for first doses are available at all large-scale vaccination clinics, the employer-led ArcelorMittal Dofasco vaccine clinic, and at any of the Hamilton Public Health Services mobile pop-up clinics. Vaccine supply continues to be readily available, and we thank our provincial and federal government partners for their work in securing and distributing vaccine to our community. Locally, we will have enough vaccine to complete the vaccine series for 75% of our community members 12 years and over by the week of July 26th. All available vaccine clinics and operating hours are available on the website at hamilton.ca/getyourvaccine. This page is updated regularly with the most updated clinic locations and information. Again, we encourage all community members to get their accelerated second dose appointments through the provincial tool available on the webpage, or you can call the provincial call center at 1-888-999-6488, or you can walk into one of our pop-up clinics because they are offering walk-in for second doses. All members of the community age 12 and up who would like a first dose of the COVID-19 vaccine are encouraged to walk into any of our large scale or pop-up clinics and get that first dose as soon as possible. And that's all I have for you today.
Thanks, Michelle. Thank you, Paul. And that's quite a lot, actually. So lots of information there, and certainly lots of opportunity for people to get their vaccine, first dose and second dose. Of all age groups now, so it's now easier than ever to get vaccinated, and we certainly encourage people to do that. It's the best way that we're going to get to that path to recovery for our businesses, as well as to protecting people in our community. So, and get accurate information. Go to reliable sources in terms of getting informed around what the vaccine means and how it can help protect you and your family. Reopening businesses obviously remains a top priority as well. It always has been when it's safe to do so. So if you can, now that things are starting to open up, support your local businesses, your restaurants, the patios. Go to the bookstores or head out to the park, or your favorite clothing retailer. All of those are available to a greater degree now. Do it safely. Do continue to protect yourselves, but there is every reason to be somewhat cautious in terms of the Delta variant out there. But it is an indicator that our vaccine is working, that we are opening up more and more as time goes by. So wherever possible, shop local and support your Hamilton businesses. And now we're going to turn it over to Jasmine to lead us through some media questions. Jasmine?
Great, thank you, Mr. Mayor. We have 5 media joining us today. As usual, we'll start with one question and one follow-up for everybody. Our first question will be to Nicole Martin from CHCH. Nicole, you can go ahead.
Good afternoon, everyone. I'm just focusing today on St. Joseph's Villa and the outbreak there. So I think my questions are for you, Michelle. St. Joseph's Villa says on its website now that it's experiencing a facility-wide outbreak. Have cases increased again? Are they tied to a variant? And how did the outbreak begin?
Thanks, Nicole. So yes, the outbreak at St. Joe's Villa, which originally was declared in the hair salon, is now confirmed as a facility outbreak. The original cases were among staff members at the hair salon, but now at this point in time, there are additional cases. Public Health Services, we continue to investigate this particular outbreak, so I don't have confirmation for you with respect to how many new cases are confirmed. That would be updated on our website tomorrow as per usual process. So we'll have the updated numbers from today there tomorrow. With respect to, your second question about a variant. So at this point in time, we don't have information with respect to what particular variant might be in play at this particular outbreak. Public Health Ontario is actually, that's who we get our information about our cases from. So they will assess the lab results from the PCR tests at this facility. It could take upwards of 2 weeks to get that confirmation. We do know that the Delta variant, of course, is the primary variant that's circulating right now, but we don't have information about this specific facility.
Thank you so much. There was also a report that it was an unvaccinated hairdresser that may have originally brought the virus into the home. I'm wondering if that's true. And also just knowing that most residents are vaccinated within long-term care homes all across the city, how is it that the virus is still spreading and spreading within St. Joseph's Villa in specific?
Thanks, Nicole. Okay, with respect to an individual staff person, we're not going to share information with respect to an individual and what their vaccine status is. I can tell you that within a congregate setting like this or anywhere, as we talked about before, it's very important that everyone have 2 doses of vaccine and a completed vaccine series as soon as possible. It's also possible that even with that completed vaccine series, although the vaccine is highly effective at reducing, severe illness, hospitalization, and death, particularly in these kinds of settings where we've had such tragic outcomes earlier this year, it really doesn't remove all risks of acquiring COVID-19 infection. We still might see COVID-19 infections among fully vaccinated individuals. This is something called breakthrough infection, and this is not just with the COVID-19 vaccine. This is with any vaccine that this is possible. It can happen, which is one of the reasons why we really want to see an overall high uptake and coverage of vaccines so we can get to a place where we're not having circulating virus within the community. Again, though, with someone who is fully vaccinated, the risk of COVID-19 becoming serious or of someone dying, of course, is significantly higher in someone that's not vaccinated as opposed to someone that is. And so we really encourage, again, the 2 doses of COVID-19 vaccine.
Great, thank you, Michelle. Our next question will be to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a good weekend. My first question, I guess, is for Michelle. And my question is, when we're looking at the vaccination map, using that ISIS data, we're seeing a lot of those East End neighborhoods have lower vaccination rates. What exactly are we doing to try to change that? Because if 95% of our cases are in relation to people without vaccines, it might pose for a real issue for those just in one particular part of that city.
Thanks, Bobby. Yes, and we've known this for some time and continue to work on this, that again, back to the piece around the Delta variant. Delta variant certainly does get a foothold within those communities where we do have a less than optimal vaccine uptake. We continue to see FSAs with lower vaccine coverage within the city. The increase in vaccine coverage and across the city overall, of course, is encouraging, but as you noted, we do have concerns with respect to some of our communities, and this remains a priority for us. Recognizing, of course, that your decision on whether or not to receive a COVID vaccine is an individual decision, and that the factors contributing to lower coverage in some of these areas truly are complex, with roots in systemic inequities, low socioeconomic status, and some of these have been exacerbated, quite frankly, by the COVID-19 pandemic. And so we are using health equity principles and trying to really use the information we have to identify where we need to focus more. So the focus previously was certainly on throughput and offering vaccine clinics and getting as many people vaccinated as possible, whereas now the shift is truly to focus on coverage and focusing on prioritization in these areas where perhaps we haven't had the uptake today. A number of vaccination clinics have been placed in these areas to reach community members who are disproportionately impacted by COVID-19 or where we're seeing lower vaccination uptake. We'll continue to do that work, of course. We are continuing to work with community organizations across Hamilton. We have vaccine ambassadors working with us now. So we have vaccine ambassadors that are reaching out to priority populations. They're reaching out to these hard to reach populations. They are focusing on youth and families and really trying to bridge the gap with respect to vaccine information, helping people remove barriers and helping them really get the information they need to be confident in making a decision to receive a vaccine. So that vaccine ambassador work is underway. We are also, of course, promoting pop-up clinics in some of our priority populations. You'll see that we've moved to walk-in, of course, for first dose in our pop-up clinics that are located in these priority FSAs and walk in for a second dose as well. So really trying to remove barriers where possible and really trying to put in place strategies where people have the ability to have those conversations, be it with an ambassador, be it with their healthcare providers that are in those areas. We have healthcare providers on site at vaccine clinics, both mobile and our large clinics, that can answer questions people have. So really trying to work a bit more in a one-to-one sort of way and try to understand what the barriers are and how do we overcome those barriers for individuals. Because we do know that vaccine, the decision again, is a personal choice, but if there's a barrier there that we can overcome, we're certainly working toward doing that.
Thank you. And are there any specific kind of goals or deadlines? Are you trying to raise the vaccination rate in those areas? Is there a time frame you're trying to reach?
So for the vaccine program across the city as a whole, when we talk about reaching particular targets, be it 75%, and I know that we hear too that we need a higher uptake really to be in a good place with respect to the Delta variant. Although we talk about that 75% at the overall city level, what we really want to see is that every FSA in the city reaches that same uptake level. So it's not an average across the city, but rather that all of our FSAs and everyone that's living in the city, really we get to that same place. So the target is the same.
Great, thank you, Michelle. Our next question is to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi there, thank you so much for taking my questions. Mine are also for Michelle Baird. So I just wanted to ask, kind of following up on Bobby's question about uptake in some of the areas where there is lower vaccine rates. I'm wondering if there's anything planned along the lines of what Toronto is doing with like door-to-door canvassing and bringing vaccines to apartment buildings.
Thanks, Maria. So at this point in time, we aren't doing door-to-door administration of vaccine outside of those folks who truly are homebound. And paramedics with our primary care partners have done a tremendous amount of work on that front. But at this point in time, we're not planning any additional door-to-door vaccine strategies.
Okay, thank you. And my follow-up question has to do with St. Joseph's Villa. In your response to an earlier question, you said that there are additional cases. Can you confirm if those are resident cases and also whether residents are required to be isolating right now and what visitor restrictions are in place there?
Yes, so with respect to St. Joseph's Villa, there are additional cases and they are resident cases. I can confirm that. I can't confirm numbers with you with respect to the restrictions in place because it is an outbreak within a long-term care home. It's the same restrictions that would be in place for any COVID-19 outbreak in that type of setting. So those guidelines haven't changed with respect to restrictions when the facility is an outbreak.
Great, thank you, Michelle. Our next question is to Emily Taylor from CHCH News. Emily, you can go ahead.
Hi, good afternoon. I believe my question will be for Mayor Eisenberger or Paul Johnson, but whoever would like to answer it. So some of the other medical officers of health that I've spoken with recently, namely in Niagara, are concerned about certain elements of step 3, namely going into it before those 21 days past step 2, but also just the size of gatherings that we're looking at. Are there any elements of stage 3 reopening that concern you?
I'll take a first go at it. So I mean, I do appreciate, and I think we're all, making sure that we're taking a cautious approach to opening up. And I think opening up too quickly with too great a numbers is potentially putting us back at risk. So, I'm comfortable with where we are on step 3, but some of the larger gatherings that are being contemplated, like sporting events and concerts, I think those larger numbers are somewhat more problematic. And I think the message needs to be that people still need to protect themselves when they're potentially, attending these events. So some physical distancing and masking will still be issues that people need to keep in mind and practice when we're participating in all of these kinds of events, because there's still an opportunity to spread the virus. And you know what, no one will know you know, those that are vaccinated and those that are unvaccinated. And so continuing to protect oneself, I think, is still going to be a very important part of any of the events that are coming forward in the near future. Paul?
Thanks, Mr. Mayor, and I agree. What we need to balance off is that I think people are feeling this reduction in the public, they call them all public health restrictions because this is about public health, and people translate that to, well, I don't have to wash my hands anymore, I don't have to keep my distance, I don't have to wear a mask, and then as I mentioned in my comments, they hear this in other jurisdictions as well and assume that this is all happening, and that's not the case. So can we, with the proper measures put in place, safely return to indoor dining, having gymnasiums available, doing some of the indoor activities, even having larger gatherings, particularly outside? The answer is yes. But people need to realize there will be, in certain cases, and the mayor talked about it, where we have large numbers of people around. If you cannot maintain that 2 meters of separation, you'll be asked to wear a mask unless you're sitting with somebody that's in your household. So what we really can't do is have this, quite frankly, this nonsense about, you know, I got to get rid of my mask. The single worst thing that's ever happened to me in my life is that I was asked to wear a mask during this pandemic. And, you know, I think that we need to follow those rules. That's the way that we can keep things safe. And then it's the other things. Don't push the boundaries. What can happen indoors and what can happen in those restaurants or in those other venues, allow it to be what it is. Don't push it further. And so all of the milling about, and yes, we can have more people gathered at a table, but those tables need to be separated. So this isn't an opportunity to just, you know, social butterfly between a bunch of tables if you happen to know people. Those are the ways that this thing can get away from us. And I think if we do the things well, there's a very good chance. But look, at some point, more risk was going to be introduced. Otherwise, we're simply going to be closed indoor gatherings for, I don't know, it could be forever if this virus doesn't, you know, disappear entirely, or we don't get to that 95% or whatever the target might be. So I think if people really do, and that's what I encourage people to do, understand the rules when you're going to do some of these things and follow them, please. And, you know, enough with the, well, I don't want to do this anymore. The good news is we're going to be able to do more things. The bad news is if we then say, well, I also don't want to follow any of the precautions to do those things, I think we could be potentially seeing some outbreaks. So I hate to be doom and gloom about it, because I don't think this is a moment where we have to be overly negative about the situation. But I have watched people believe that once certain things start to disappear, it means everything disappears. And that's not the case. If you look at what's still required in a number of the settings, whether it be restrictions on numbers, whether it be the continued use of masks and physical distancing, those things are in place so we can have more people congregating in different environments, but we can do it safely. And those will be the key points for people to bring forward with them as they start to do more of these activities.
Thank you. Just as a follow-up, how is the city helping businesses prepare and looking at enforcement of these rules?
So the city's had a tremendous partnership with the Hamilton Chamber of Commerce right from the very beginning stages of the pandemic, and that will continue. So I know that Public Health Services has a Chamber of Commerce sitting with them at their infection prevention and control tables. And so I know the Chamber will continue to provide the best information it can to businesses. Clearly, you're going to see a shift in enforcement now to really making sure that people understand the new world that we're going to be in, because this is the place we're headed for you know, hopefully forever, that we don't take a step backwards, that we continue to have more people doing more things in all of the spaces that we used to do. So it will be about the engagement and the education, except in situations where it's really clear that people are just choosing not to follow the rules. And there will be a prioritization in certain areas, and certainly those indoor dining situations, the gyms where we have seen cases in the past, those will be areas where we're focusing on that indoor recreation to make sure that it's being done safely. But I think you'll see a lot more of that education as the general public and businesses themselves welcome more and more people into their services. And then the Chamber of Commerce has been fantastic. They have facilitated access to businesses for rapid antigen testing if people want to do some of that rapid testing for employees at their businesses and all of those good things. So I couldn't be prouder of the work that we've put in place throughout it. And whether it was the mayor's task force on economic recovery and the bringing of businesses, whether they be for-profit or not-profit, to the table early, whether public health work and making sure that business leaders were part of the infection prevention and control conversations. And why that was important is sometimes public health can say, this is what we want to see in place. And it makes great sense from a public health perspective. And the businesses might say, there's no way we can operate if you do that. So the question has always been, how can we protect people, but make sure we have the right things in place? And it's just been a good partnership throughout. So those supports won't disappear. And then the other side is that our enforcement folks will be there to lay charges when it's very egregious violations, but clearly a shift happening starting on Friday and moving through the rest of the summer to making sure we're back into that education mode to keep the entire community safe.
Great, thank you, Paul. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the question. My question's for Michelle. Are you confident that Hamilton can reach these provincial vaccine targets, as our numbers seem to be really plateauing, especially among first doses? And what exactly are you doing to get there other than these walk-ins now?
Thanks, Joanna. Yes, I am confident that as a community, we can get to those targets that we're working toward. And Hamilton, like other communities in the province, we're all sort of plateauing with respect to first doses. And that's not surprising either, that we knew that, you know, that first group out of the gate, certainly there was lots of desire, and at points, at the beginning, we certainly had more desire for vaccine than supply allowed for, and now we're in a very different place, of course. There is more work to be done, I would suggest, with respect to getting that next group of people vaccinated, be it first dose or second dose of vaccine. With respect to the walk-ins, that's absolutely one strategy. We're also seeing vaccine move out into the community a bit more, where primary care and pharmacies across the city really playing a bigger role. So for individuals who do have questions, who aren't quite sure yet whether it is the right decision for them, really encouraging people to have those conversations with healthcare providers, be it at their primary care practice, at a pharmacy, or elsewhere. We're offering some opportunities for people to connect with the ambassadors, as noted previously. So these ambassadors truly reflect our community in Hamilton. And so they are at locations, they're at clinics, they're also at community drop-ins, things like that, where they are having one-to-one conversations with people and really helping them. And that kind of work will continue as we move into July and through August. You're absolutely right, Joanna, that additional strategies are needed. And so it's really these very targeted strategies specific to communities and specific in some cases to workplaces. We're really trying to get that needle to go just a little bit further.
Thanks so much. My next question is also for you, Michelle. Do you know why Hamilton is lagging behind the province in terms of our vaccination rates? I mean, we're a good 4% behind, 4 to 5% behind. Can you talk about why that is and what you're doing to fix that?
Thanks. So that one is a difficult one for sure. I would say at the outset, it's really difficult to compare area to area. At the outset, as you know, there were certain areas in the province where really identified as hotspots, and significant vaccine supply was dedicated to those areas, rightfully so, because we were trying to get some significant outbreaks in hand. We're now at a place, of course, where we all have lots of access to vaccine, which is great, but you'll see that some of those communities still are out a little bit ahead of us. If you look age group to age group or earlier on, for example, we did tremendous work getting our healthcare workers and similar professions really vaccinated well in order to protect our healthcare system. And perhaps others didn't take that same strategy. So again, it's just hard to compare community to community versus we're all at this point working toward the same targets of trying to get an overall high community uptake, and we're working toward that as are others.
Great, thank you, Michelle. So we have a bit more time today, so we'll go through for one more question each. We'll go back to start with Nicole Martin. Nicole, if you'd like another question, you can go ahead.
Thank you so much. I just want to go back to St. Joseph's Villa again for a second. I know, Michelle, you're saying you're not going to confirm if someone was vaccinated or unvaccinated, but isn't this an opportunity where we could try and motivate some people to get the shot, seeing that it can spread within the home?
Thanks, Nicole. Absolutely. So this is a very good example of how I think, back to Paul's discussion earlier, that people feel like things are opening up and we're good to go with everything. This is a prime example for us of where the vaccine is still, the virus is still active within our community. And we do all need to be vigilant and maintain those public health measures. And in addition, really reinforcing the importance of vaccination and how effective vaccination truly has been in long-term care homes and congregate settings like that over the past couple of months. We're truly in a different place than we were earlier this year. And so in this particular case, of course, we don't have information on individual staff members or even overall vaccine uptake within long-term care homes. That really is both from a privacy perspective at the individual level, not something we can share. And at the facility-wide level, we no longer keep accurate information about that at public health. It's really at the facility that has that information. But certainly, yes, this is a great example to remind people the importance of vaccination and how vulnerable populations are living in these congregate settings, and seniors in particular, and that really the onus is on all of us to do our part to get a vaccine and really protect ourselves and protect our community.
Thank you, Michelle. We'll go back to Bobby from CBC Hamilton. If you'd like another question, Bobby, you can go ahead.
Thank you. I'd also like to ask about St. Joe's Villa. I mean, we were just told a stat about the number of people who haven't been vaccinated, the number of people who have been infected and didn't have a vaccine. So I'm just wondering, how do we not have these stats now? And aren't these important stats to have? Aren't these important stats to share for the public to know?
Yes, thanks, Bobby. And they absolutely are important. So I will explain, I guess, a little bit better. So on an individual case basis, when we collect case information about a COVID-19 case, at this point in time, we do collect vaccine status as part of that case follow-up. And Public Health Ontario looks at all of that data in a holistic way, if you will, so that we get information as a whole in the province with respect to what our cases look like, really from a place of vaccine efficacy. Is the vaccine working? And it absolutely is working. Understanding, of course, that we're still going to see no vaccine is perfect, so we still will see some of those breakthrough cases. With respect to uptake within long-term care, I think that I perhaps talked about the two of them together. Long-term care homes as well collect information with respect to their staff vaccine uptake, so they'll know what percentage of staff are vaccinated, of course, from an employment perspective. But we wouldn't necessarily have the most up-to-date information with respect to what the vaccine uptake is within long-term care homes overall, because their staff continue to get vaccinated every day. They also have turnover, of course, in staff. And so that number is very fluid. So I would say as an overall, we don't necessarily know the number accurately with respect to who's been vaccinated in long-term care. On an individual case basis, we don't give specifics about individuals.
Great, thank you, Michelle. We'll go next to Maria from the Hamilton Spectator. Maria, if you'd like another question, you can go ahead.
Hi, thanks for the additional question. I think this one is for Paul Johnson. And the question is, pre-pandemic buffets were high touch and involved lineups with numerous households mingling. What concerns does public health, it's probably for Michelle. What concerns does public health have about reopening buffets, and what advice do you have for restaurant owners?
Thanks. So with respect to buffets, no different than any other setting. Again, really important that you're, careful and diligent yourself with respect to where you're going, with respect to distancing. COVID-19 very much transmission, as you know, is droplet transmission. So coughing, sneezing. So really distancing yourself from other individuals. That 2-meter distancing is most important. Masking when that's not able to be maintained. With respect to surfaces, throughout the pandemic, certainly at the outset, that was thought to be quite a significant concern. And then we've learned as we went along that surfaces aren't the important vector that we might have thought they were, that really important piece truly is the person-to-person transmission through respiratory droplets.
Great, thank you. We'll go next to Emily Taylor from CHCH News. Emily, if you'd like another question, you can go ahead.
I'm all right, actually. Thank you.
Great, thank you. We'll go back to Joanna then from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. I think my question is for Michelle. As we move into step 3, what tips do you have for parents of kids who are not old enough to be vaccinated? Like, are there extra precautions that children and parents need to take, or places they need to avoid, or things that are opening up that maybe are not for them at this point?
Thanks. So at this point in time, yes, for those under 12, of course, that can't be vaccinated, understand and appreciate that parents have concerns. I guess our first message continues to be that everybody else in the household who's able to be vaccinated should receive 2 doses of vaccine. That does protect themselves, but of course protects their household as well. For those children, the same message as for others, that really try to maintain distancing where possible, encourage respiratory hygiene, and, where possible, have those children mask when they are within distance, close proximity to others within closed spaces. So the messages for that age group really haven't changed. We're still optimistic, of course, that a vaccine will become available for that age group. But for now, those same public health measures that we've all been carrying out for the past few months would stay in place for that group.
Great, thank you, Michelle. Mr. Mayor, that's all our media questions for today, so we'll pass things back to you.
Thank you, Jasmine, and thank you to our media partners for their questions, and to Bill Custers and the entire team at Cable 14 for putting us together, as well as Clear Cable, that have been very, very helpful in making sure there are 100+ media advisories over the last year and then some have gone smoothly and been very informative. So thank you all for that. For more information on COVID-19 and the financial supports and any updates, visit our website at hamilton.ca/coronavirus. Continue to follow the public health measures and advice, and get your vaccine. And as Paul pointed out, it is not all clear. As much as things are improving, and we're all loving the fact that things are opening up, it is still time to maintain caution and protect oneself from being in contact with the virus, especially those that have not been vaccinated. And certainly that's a caution that hopefully those folks will consider getting vaccinated to protect not only themselves, but their families and loved ones around them. As we head into summer, we want to ensure that our residents and local media are continuing to receive regular updates from the city. So we will be holding the bi-weekly media briefings on Monday at 3 p.m. throughout the summer. Residents can find the latest information on the city's website at www.hamilton.ca/coronavirus, or by following us on the social media channels. And that is everything for today. So enjoy the weather. Summer is upon us. Great opportunity to get out and enjoy some of the things that you like to do. Sports facilities are open. Soon our pool and recreational facilities will be open as well. The splash pads are open, the parks are open. Lots of things for you to do and enjoy. And by being mindful of that, there's still need to think about the virus still being out there and potentially could be harmful. And we want to avoid that continuing spread. So in the meantime, have a great summer. We'll see you in a couple of weeks. Actually, next time will be July the 26th at 3 p.m. And in the meantime, be well, take care of one another, and enjoy your summer.